I want to make just a couple points. So as we've all been talking about, we have 4 ambulances here in Garden Grove. We have one basically over in the Knott area. We have one in sort of Central Garden, 2 in Central Garden Grove, and we have the 4th one over in the east side of town. I think it's really important for people to understand. I know a lot of people think the people driving our ambulances are paramedics and EMTs. They're bus drivers. For lack of a better, they drive the patients to the hospital. They're drivers. So what happens is, somebody said, what happens if somebody has a heart attack? So if somebody has a heart attack now, the people that get there when the 911 call is made, the first people that get there are our firefighters in the fire truck. And we now have 4 firefighters arriving instead of 3. 2 of those firefighters are paramedics. So when they get there, they're able to immediately get to work on a person, try to stabilize them. At the same time, the ambulance is coming from some direction, wherever it's closest. So
who dispatches the ambulance?
The ambulance is dispatched. The 911 call comes in. It goes to our police dispatch operation. Dispatch immediately sends it to OCFA, so our fire trucks are on the way immediately, and at the same time, it goes to Cary Ambulance to get the closest ambulance. But what's most important in the response time is for our firefighters to get there, because they're the paramedics. They're the ones who are going to be working on somebody. So they get to the scene. They're working on somebody who's in cardiac arrest. They're doing everything that they can within the times and, everything that's supposed to be doing. At some point, then, an ambulance will arrive if it's an advanced life support system. And at some point, the paramedics will get that patient in the ambulance, and then they ride in the back of the ambulance, both of our 2 paramedics, and the driver drives them to the hospital. Somebody's mentioned one of our ambulances could be in La Palma. Some of that depends on where a patient tells the ambulance or our paramedics where to take them to. They've got a doctor somewhere, they've got something, so it could, a person could be taken to another hospital.
And all that is true, but it doesn't minimize the rapid need to get people to the hospital.
Yeah, I've been waiting to talk, so can I have some time, please?
Fat, and then Tuha next.
Well, I had a couple more things.
Yeah, let's go finish, and then Fat, and then
I'll try to wrap up. But I thought it was really important to mention that the ambulance drivers are drivers. They're not providing any medical care to anybody. They can't. They're not allowed to by law. It's our paramedics that are in there. The other point that I wanted to make is, so OCFA is our Chief Fennessy, Brian Fennessy, is